My name is Farquhar. I'm a consultant in sleep medicine at Evelina London Children's Hospital. My day job is very much about trying to help children, young people and families with complex sleep difficulties. But as was said there, I've got a bit of an interest about trying to help support healthcare workers in terms of what you have to do when we ask you to work around the clock, basically. So a little bit about the practical applications of some of the things that Colin was talking about in the previous talk. Let me just start my presentation, assuming that works. So what I'm going to do is give you quite a brief overview, actually, of the issues, how that kind of practicalities of sleep that you just heard about kind of links in with the job that you are hopefully all coming to do. I spend quite a lot of time talking about this in quite a lot of places, and if any of you are on social media and are interested in any of the things that I'm talking about, Twitter is quite a good place to catch up with me, and I've got lots of stuff on there that talks in more detail. One of the things about sleep is that we haven't really paid very much attention to sleep, particularly in healthcare and in undergraduate curricula for healthcare professionals and in postgraduate teaching and training. But there is increasingly an emphasis, thanks in part to people like Colin, like myself, like many others, that sleep is something we should be paying a lot more attention to. And particularly the last few months, I think, has illustrated this. As soon as we start talking about the importance of sleep, many people come back to us and say, look, I know that you're telling me that sleep is important, but actually, I've got a lot to do in my life. I've got lots of stresses, lots of pressures, lots of things that I need to be cracking on with and getting done. And actually, many people find it difficult to prioritize sleep in their lives. And we see quotes like this popping up. This is from the British Medical Journal, which is as good a way of any as getting a flavour of what doctors are thinking about in this country. And this kind of thing rings very true. But one of the interesting things about sleep is that although, as Colin has illustrated, we are increasingly understanding lots and lots more about the complexities of sleep, actually lots of the basic principles of how to get good sleep haven't really changed very much. And this editorial was actually originally published in the VMJ in 1895. And none of this has really changed in terms of when people are thinking about how to get good quality sleep in their lives. We think 1895 is a long time ago. My rush hour commute, if I got it wrong, looked a bit like this. In 1895, it's in black and white rather than colour, but actually the world and the people weren't very different. We spend a lot of time today telling you that you're spending far too much time on your electronic screen devices and you don't talk to people on public transport, and the world is very different and all the rest of it compared to before. And obviously you dial back and actually the technology changes, but the people didn't. And that's really important when we're thinking about sleep, because when we're trying to encourage people to think about getting good quality sleep, a lot of the time what we're asking people to do is do the really simple basics well. And that becomes more challenging, as I said, when you start working around the clock. The other thing about sleep is that it faces lots of challenges. We are currently seeing that very much illustrated about that many people in the country are sleeping less well due to anxiety and worry due to the coronavirus pandemic. But as Professor Kumar said, these things are not new either. And we go back to 1918 and the influenza epidemic disrupted people's sleep in much the same way. So whilst we do understand a lot more about sleep, actually a lot of the basics about it and how it impacts our lives are actually still fairly constant. Colin told you lots of the reasons why sleep is important. I like to boil it down to a really simple basic rule, and that's to say to think about sleep as an MOT for your brain and body every night of your life. Your brain and body is a complex piece of biological machinery, and you need to have regular maintenance going on for that to be able to keep it functioning at its best. You need a certain amount of sleep that is unique to you each night to keep your brain and body working as well as it should. And as soon as you start to miss out on that sleep, if you don't prioritize getting that essential maintenance time, then things will start to develop as problems. And the longer you go without that maintenance, the more problems tend to develop. We know that that's an issue for pretty much everybody in the country. So when we look at how much sleep people get compared to how much sleep we think they probably should be getting, we think that most adults in this country are probably missing out on about an hour of sleep every night of their lives. And that doesn't sound very much. You're meant to get 7 or 8 hours of sleep. You get 6 or 7 hours of sleep. You reach for the coffee in the morning. Everything is fine. But if you think about that in a slightly different way, if you are missing an hour of sleep every single night of your life, then you are missing the equivalent of an entire night's sleep every week of your life. And that is going to be something that will begin to have a consequence on your health and well-being. And that's long before we start thinking about you as coming into the NHS as future healthcare professionals. So you are probably sleep deprived already, and that is one of the big challenges when we're trying to help people to think about improving their sleep. We have to tackle that as the kind of big elephant in the room. You, I think, so the people I'm talking to, I think, are predominantly adolescents. So I think you are probably all in your late teens, early 20s. And actually, biology and the world conspire against you a little bit. And actually, teenagers and young adults are often particularly sleep deprived just because of the fact that the way that your sleep works at this stage in your life doesn't really synchronize with the way that the world expects you to perform and do things. So actually, you were probably a bit more sleep deprived compared to older adults. We then start to think about the fact that you are coming into a job where what you are signing up to do is to provide care 24 hours a day, 7 days a week, 365 days a year as part of a team. The NHS, to do the job it is here to do, has to have people working at every hour of the day and night. And as Colin's already explained to you, one of the problems with that is that you have this really strong internal body clock that is telling you that you are meant to be awake in the daytime and asleep at nighttime. When we ask you to work at night, we are asking you to do something that is profoundly unphysiological and unnatural. And that is something that we need to be better about thinking about how we support people when asked them to do that. It's not just healthcare. As you can see here, there are lots of people who have to work at night. And these are all people doing jobs that help to keep you safe. They help to make our world work more efficiently. They help to make your life more convenient. And often we don't think about all these people doing work in the night. But actually, there's over 3 million of them. 13% of our workforce work regularly at nights. £66 billion per year of our economy is generated by people working at night. And that's 3% of our entire gross domestic product, which is a huge percentage in terms of the things that make up our GDP. So we should be thinking a lot better about how we support people who work at night. As Colin said, that body clock is a big problem with this. You will probably all be familiar with the concept of jet lag and how uncomfortable that feels. Jet lag is the physical and mental consequences of your brain trying to work to a different time rhythm to what the world is telling you it should be. And when we ask people to work at night, we are asking them to work as if they are jet lagged. And that is a basic principle that I don't think we pay enough attention to in terms of thinking about how we support people. It matters for lots of reasons. One of the most important is that when you are working at night, you are more likely to be fatigued, you are more likely to be tired, you are likely to make mistakes. And when people in positions like ours make mistakes, the consequences can be very significant. So we should be thinking about how we reduce this. And the two you've heard from already this morning, one of the things they're looking at is what they can do to try and help support these kind of things. Colin alluded to the fact that when you are sleep deprived, that it affects lots of things. You don't need to worry about the small print on this slide. This is a state-of-the-art review from the BMJ from a few years ago that looks at the health of people who work shifts. And this is the type of evidence that I think that everybody who asks somebody to work at night shifts should be aware of. Because when we ask people to work at night, we're asking them to do something that is bad for their health. Fundamentally, working at night shift is something that is going to make your health more vulnerable and cause you harm unless we are working to minimize that as much as possible. This is the very depressing bit of this talk. The absolute worst outcome from this is, and the reason I started doing a lot of this work when I became a consultant 7 or 8 years ago, is that we still regularly see doctors and nurses who crash and die just trying to drive home after a night shift. And this is the impact on them of fatigue. That means they're falling asleep behind the wheel. If we don't get this right, if we don't think about supporting sleep fatigue within an organisation like the NHS, then the consequences are absolutely catastrophic. Why does that happen? Well, we know that if you are fatigued, if you've been awake for about 16 to 18 hours on average, actually your reaction time is the same as if you're at the legal drink-drive limit. And most people would hesitate to get behind the wheel of a car if they were at the drink-drive limit or if they'd had any alcohol. But most people don't hesitate to get behind the wheel of a car if they're tired because they don't see it as being the same problem. But actually driving hard is like driving drunk, and your risk of having an accident is just the same, if not more, as if you were at the drink-drive limit. So for these kind of reasons, we think it's really important that we talk to people who are working within healthcare as early as possible about these issues, that we're honest about them, and then we work to try and minimize that, both by thinking about things that you can do as individuals to try and help optimize your sleep, but also what people should be doing as NHS employers to try and support this and make this better. To do that, we do a lot of teaching. So this is an hour of teaching condensed into one slide. But this is the type of teaching that I do over an hour that kind of takes in some of what Colin had said and in more detail the things that I'm touching on here to talk with people who work nights about how they can cope better with this very unnatural, unbiological thing that we're asking them to do. We talk to them about improving their bedrooms and making sure their sleep environment is as good as possible, We talk to them about all the things that are good and bad for sleep and explain to them why things like being on your phone at the end of the day is maybe not the best thing to be doing for your sleep. We give them hints about how to work through night shifts. We talk to them about how to get home safely at the end of a night shift and how to optimize controlling that body clock. And we talk to them about how to recover from doing night shifts. And we give them as much information as we can to try and help them to understand their sleep better so they can work better in the jobs that you're doing. And we know that just doing that teaching improves sleep and night shift habits for about 3/4 of people. So we know that this type of teaching can be really valuable in helping to change people's way of doing things. You are right at the very beginning of this journey, though. So you're sitting there going, well, it's going to be years before this applies to me. Why does this matter to me? Well, being a medical student is tough as well. And actually, as I said, for lots of reasons. So one, biologically, your sleep is still at a point where it is a little bit different in terms of being an adolescent. And that doesn't really kind of revert to adult until you're about 25 or so. But also, medical school is quite intense. There's a lot of pressure, there's a lot of stress, there's a lot of worry, there's a lot of pressure on you to perform in medical school. And when we look at the sleep quality of medical students, we find that already we are seeing examples of poor sleep habits developing and the consequences of that. So again, if you're interested in that, the link to this paper is there. But the bottom line is that we should be thinking about sleep for medical students just as much as for graduated professionals to try and get good habits early. Colin touched on this. An example of this is that you depend on your sleep for learning. If you didn't get a good night's sleep last night, you won't be taking in the information today as well. If you don't get a good night's sleep tonight, you won't remember the things you've learned today as well. So sleep is essential for learning, and clearly that's a big part of medical school. Some of the things that I talk about in that lecture, if you want more detail on that, about how to think about improving sleep, the link to that is there. And I can send these links to the organisers to send on if anyone's interested. The last bit of this ties in a little bit with things that we're touching on in all of the talks so far, and that's about the idea of health and well-being in general of our teams, of our staff within the NHS. When I started out as a junior doctor, the very first book I was told to read by an intensive care consultant was this book, The House of God. It is a fiction, it's a narrative of what it was like as a junior doctor in America in the 70s. So it's now getting to be ancient history, but actually lots of its content still rings true. It's a very stressful, very pressured job being a doctor, particularly that first year. And one of the characters, when they're all at their absolute lowest, is how can we care for patients if nobody is caring for us? 50 years later, we are up to that idea. And organisations like Health Education England that Ged worked for, who spoke to you at the beginning, are starting to look at the impact of looking after the staff within the NHS to make sure that we are providing best care. We have to think about looking after you right from the very beginning of your healthcare journey, because if your health and well-being is not as good as it can be, you cannot deliver to your patients as well as you should be. There is beginning to be a very big focus on this. The General Medical Council published a report at the end of last year that basically said we have been very bad about doing this historically, and they are saying that we need to transform the way that we deliver teaching and training for medical students and doctors to make sure that these principles are built in from the very beginning. We can't go on the way that we did before. We have to think about how we look after your health and well-being if we are going to be able to carry on delivering care to our patients. And there's lots of recommendations for that report, but from our point of view, from people like Colin and me, there is a huge emphasis about getting rest and sleep right. And if you're going to work at nights, then we want people like Colin involved in designing those rotas to make sure that they are the least harmful they can be, to make sure you can do your job well. Coronavirus has come along and has emphasized many of these points. Many of us have felt more anxious and stressed and worried over the last few months. Has had a big impact on sleep. About 50% of everybody in the whole is sleeping less well over the last few months. This is research from King's College demonstrating that. And it means that it is absolutely worth you starting to think about those things that Colin was speaking about in his talk, to build in strategies that can help you to relax, to wind down, to optimize your sleep. The earlier you look at these kind of things and build these habits in, the better they're going to serve you for your entire career. So I would absolutely commend you looking at things like this. That's that paper again, just in case anybody's interested. And that's me. You're all, I am sure, going to be absolutely brilliant as you come and join us and working as doctors and healthcare professionals in the NHS. It is a job to help to make sure you are able to do that to the best of your capability. And a huge part of that is you thinking about making sure that your sleep is as good as it can be. That's me. I don't think we're doing questions, so I will stop there.